So my name's Laura Mamounas, and I'm a program director at the NINDS. And I've been at the NINDS for almost 22 years. So NIH funding of Rett syndrome is close to about $20 million per year. And given the multi-system involvement in Rett that I discussed before, over 10 different NIH institutes support research in Rett syndrome, but the majority of support is coming from NINDS, where I work, and my sister neuroscience institutes, NICHD and NIMH. And so the areas that we're the type of research that we're supporting is really trying to understand how the loss of MECP2 function leads to brain dysfunction and neurodevelopmental abnormalities. So, for example, some of the research has shown that, um, you know, the changes that we see include impaired neuronal development and maturation of neurons, um, less complex and dendritic processes, which are really very important to synaptic function. And the lack of MECP2 also is being shown to affect neural circuits and connectivity. And research that we have supported has shown that the Rett syndrome pathology is not just limited to neurons, but also can impact glial cell function as well as interactions between neurons and non-neuronal cells, including astrocytes, microglia, and oligodendrocytes. The NIH is also supporting, um, many studies that are early preclinical studies that are designed or are trying to identify promising new therapeutic targets for future clinical trials. And we also support what we call clinical trial readiness in Rett syndrome. For example, we support natural history studies so we can understand the course of the disorder. We support research that is targeted to improving outcome measures that can be used in clinical trials and biomarkers that can be used in clinical trials that will let us know um, whether a treatment, give us an early signal of whether a treatment might be beneficial, as well as helping us to determine which patients might benefit from this treatment versus that treatment. The neurogenetics cluster, the work we do is largely focused on understanding neurodevelopment, just the normal processes of neurodevelopment, and then, what can go wrong when there are neurodevelopmental disorders. So, as I mentioned, I manage grants on many of these neurodevelopmental disorders. I also manage grants on autism. Um, my colleagues are managing grants on some of the, metabolic disorders that are usually neurodevelopmental in origin, but not always. Down syndrome. One of my colleagues, manages grants in the muscular dystrophies and in spinal muscular atrophy. So, we have a really broad range of mostly genetic disorders that we cover, and most of them have an early onset, in childhood. And we also have do a lot of research on just understanding the mechanisms that lead to basic, neurodevelopment.